As for the presentation before us, one of the challenges that I think we are seeing in the community is that the health status of Canadians has absolutely worsened in the last several years. We have seen a decline in life expectancy. And I think part of that is that we have seen vaccination coverage fall, especially through the pandemic response times. And I think that is something that has been well covered. Running against health conditions worsening is that public health resources are declining when adjusting for inflation. And particularly in terms of vaccination, we've seen new vaccine introduced, especially COVID-19 vaccines, and no new money coming to public health. And this has really challenged our ability to deliver services around vaccination to the community at the needs that are needed. In our 2025 operating budget, which the board approved, we outlined that one of the ways we we're going to try and manage this tension moving forward was to better leverage technology and to drive efficiencies from that so that we are able to do more with fewer resources. One of the areas we've applied this is actually in the work here that we're going to talk about, which is around vaccinations of children who are in childcare. Ontario law requires that we are reviewing the vaccination status of all children in childcare and following up with families to support families to get those children up to date. We had not been able to do this work since the pandemic was onset, and coming out of the pandemic response, we did not have the capacity because of those other challenges I mentioned to take on this work. Thanks to some of the support we got from the Board of Health with last year's budget, we were able to invest in technology, and using that, we're able to resume this work at a lower cost and with a lower effort, but nonetheless getting the full benefit of supporting children to get their vaccines up to date. So I think this is an excellent story for the health of our community and for sustainability of the services and for the investments the Board of Health made last year. And with that, I'll invite Sarah Noble, who's a manager of vaccine preventable diseases, and Nikki Lamont, who's a specialist with that team as well, to deliver this.
Good afternoon. I'm Sarah Noble, Program Manager for Vaccine Preventable Diseases, and this is my colleague Nikki Lamont, the specialist for a little overview of our organizational chart. The Vaccine Preventable Disease team falls under the Health Promotion and Vaccine Preventable Disease Division. And then we report to the Director and Chief Nursing Officer, Stacey Gill. Why immunization matters in licensed childcare. The Childcare and Early Years Act, CCEYA, outlines immunization requirements for licensed childcare settings in Ontario. This legislation applies to children enrolled in licensed childcare, as well as staff, volunteers, and students completing educational placements. It is implemented in alignment with the Immunization for Children in Schools and Licensed Childcare Settings Protocol, part of the Ontario Public Health Standards. The primary goal of this section of the Act is to protect children, staff, and others within childcare centers from contracting and spreading vaccine preventable diseases. Local medical officers of health determine immunization requirements for childcare staff. Under Section 22 of the Health Protection and Promotion Act, we may exclude unvaccinated staff or children during outbreaks. Licensed childcare centers must submit enrollment information to public health. We are responsible for collecting, reviewing, and maintaining immunization records for all enrolled children to identify those at risk for vaccine preventable diseases. If a child's immunization record is incomplete, we contact parents with instructions on how to update the records. We have developed a handbook and social media materials to clarify immunization requirements for licensed childcare centers and to raise awareness about the parental responsibility of reporting children's immunization records, leveraging tools like QR codes to direct parents to relevant online resources. Currently, there are 19 licensed childcare providers who operate 79 sites across the service area. There are approximately 2,700 children enrolled across all sites. During our assessment in June, 1,341 children had incomplete records or were overdue for required immunizations. Parents of children who have overdue immunization records received a letter outlining which immunizations were missing, how to receive the vaccines, how to report the records to public health, and with a deadline to respond. After the deadline to respond, approximately 550 parents responded to the initial request to update their record. We then notified childcare centers of families who missed the immunization compliance deadline. As childcare centers are legally required to maintain up-to-date vaccine records, the responsibility for following up with these families was transferred to them. In previous years, public health handled the follow-up. The communication through the centers has proven more effective. This is largely because childcare staff interact with families regularly, are familiar with them, and they are required as well to keep physical immunization records for all children and staff. The CCEYA programming had been on hold since 2019, largely due to the demands of pandemic response and post-pandemic recovery. Over the past several years, our capacity to maintain this work shrank significantly as we took on new responsibilities, including COVID-19, RSV, and other emerging priorities without additional funding. This contributed to many records becoming outdated. In 2024, we resumed and modernized the process by leveraging technology and cross-agency collaboration. External SharePoint sites now allow childcare providers to upload registered data electronically, replacing outdated email, fax methods. These changes significantly improved data accuracy, timeliness, and reduced manual workload. In addition to collaboration with the Wellington Dufferin Guelph Public Health, we piloted new technology that automated letter generation for CCEYA. UPD Vaccine Preventable Diseases team partnered with other teams across the agency to pilot process improvements for supporting CCEYA assessment, focusing on tech-driven efficiency and better data quality. Since the programming hadn't occurred since 2019, it was a chance to enhance and rebuild processes. We partnered with Wellington Dufferin Guelph Public Health to pilot technology that automates letter generation. Enhancements in data auditing and validation simplified the review process. Additionally, we used secure data transfer to send letters to an outsourced printing service, which managed printing, packaging, and mailing. Together, these technology-driven improvements streamlined tasks that previously required significant time with both administrative and nursing staff. These improvements saved an estimated 645 hours of staff time and approximately $32,000 in costs. This increased staff capacity, enhanced overall efficiency, and enabled the delivery of more VPD.
This work is made possible through strong internal and external relationships, process improvements, and effective use of tools and expertise. Insights from this pilot will be refined and scaled as we advance the upcoming Immunization of School Pupils Act, also known as ISPA, enforcement programming in early 2026. ISPA is the Ontario legislation that requires children attending school to be vaccinated against designated diseases, unless they have a valid medical, religious, or conscientious exemption to protect public health and prevent outbreaks in school settings. ISPA programming is 7 to 8 times more labor intensive than CCEYA programming. Due to a significantly larger student population, the requirement to send 2 notification letters plus a suspension order, and the added responsibility of enforcing the act, including student suspensions. Leveraging technology to streamline letter-related processes for ISPA programming can lead to substantial time and cost savings. For example, applying the same automation used in CCEYA to ISPA letter generation could result in a potential cost savings of approximately $60,000 and a time savings of around 1,260 hours of nursing time, which can be redirected towards delivering additional services. The VPD program has proactively leveraged technology-driven process improvements, demonstrating a strong commitment to optimizing efficiency while strategically reducing time and cost expenditures. One major enhancement last school year was moving the vaccine education session for exemption requests online. Previously, parents had to attend an in-person session at a health unit office to obtain a vaccine education certificate for religious or conscientious exemptions under the ISPA Act. Now the session is available online and parents can complete it and request their certification through the website, making the process more convenient and accessible. Past school year alone, approximately 200 exemption requests were submitted online. By offering the video digitally, we've saved an estimated 100 hours of public health nursing time, creating, again, more time for service delivery. Another way we've advanced our use of technology this fall is by implementing digital consent forms for the grade 7 school-based immunization clinics, replacing the traditional paper-based format. Parents now complete consent forms online, eliminating the need to send paper forms home with students. This shift improves privacy, reduces the risk of lost or misplaced forms, and allows parents to choose their preferred language, regardless of the language used at their child's school. Consent forms are easily accessible by scanning a QR code. You can also track how many parents have scanned the code, which helps inform planning and outreach efforts. The response rate has increased from 37% last school year to 60% this year, and we expect it to further continue to rise throughout the fall. So far, this transition has saved approximately $1,800 in printing costs. This shift has also reduced administrative workload by eliminating the need to sort and collect paper forms. We've saved the equivalent of 2 weeks of nursing time, allowing more time to deliver additional services. Through the strategic use of technology in the VPD program, we remain firmly committed to protecting our communities, enhancing service delivery, and ensuring timely immunization, while streamlining operations to reduce costs, minimize staff workload, and reinvest capacity into frontline services. Thank you. Any questions?
Thank you, Sarah, and thank you, Nikki, for the presentation. Does any board members have questions? Angela, go ahead.
Me, first of all, for the presentation. It was very thorough and informative. I have a couple of statements I'd like to make with regards to the terminology and the act that you're referring to. When it comes to religious beliefs, I think that us as a board need to do due diligence under Dr. Hershey's leadership to ensure that there's an acknowledgement around exemption, not just around a religion, but around Citizens Plus, where we have not had a very positive relationship with any religious structures, as history has now demonstrated. So I think for us as a leadership and as a governing board to public health in this territory, there needs to be efforts made through Dr. Hershey to ensure language is being changed that recognizes us as the original people, as Citizens Plus, that it's not just around exemption of religion.
Thanks, Mr. Chair. Very much appreciate those comments, and we can take what we can from that. Challenge here is that this is actually a provincial legislation, and the province's form is very explicitly called a conscientious or religious objection. And so we would need to lobby the province to change that act. Happy to send that feedback to them, though I don't know how much success that we would have. But I think absolutely how we operationalize this, we can be thinking more broadly.
I think the fact that we put a statement in, we need to do due diligence. And if we're trying to build relationships with the First Peoples in this territory, then we have an onus to ensure that we're doing every effort, whether the governments, which they normally don't listen to, but if there's an urgency around a collective position around changing language, then, you know, get the chiefs involved. And I think that's one of the relationships that we need to forge as a board. So to me, watch that.
Did you have a follow-up question or was that?
That's it.
Okay. Any other directors have any questions for the presenters at this time? And go ahead.
To you, Mr. Chair, you said you've received about 200 exemption requests. What percentage of those are granted?
Who wants to take that?
They're all granted.
Okay.
Any other questions? Hearing seeing none. Thank you for the thorough presentation.